Self-concept is the way individuals feel about and view themselves. This involves conscious and unconscious thoughts, attitudes, beliefs, and perceptions. Body image, a component of self-concept, refers to the way individuals perceive their appearances, sizes, and body structures and functions. Sexuality and sexual orientation are integrated into an individual's personalities as well as their general health. Sexuality encompasses physical and emotional connections with others. Individual sexuality and sexual health are influenced by self-concept, body image, gender identity, and sexual orientations. Nurses should assess their own comfort levels with issues related to sexuality because clients can sense nurses' discomfort. Nurses should have a knowledge of sexual growth and development and an understanding of how health promotion and treatments, health problems and treatments affect sexuality. So again, self-concept is how one views themselves. Self-concept is subjective and includes self-identity, body image, attitudes, role performance, and self-esteem. Individuals who have high self-esteem are better equipped to cope successfully with life's stressors. Stressors that affect self-concept include unrealistic expectations, surgery, chronic illness, and changes in role performance. Individuals who have a positive self-concept tend to feel good about themselves. Individuals who have a positive self-esteem feel capable and competent. Physical, spiritual, emotional, sexual, familial, and socio-cultural stressors can have an adverse effect on self-concept. Body image. Body image changes with cognitive growth and physical development. During adolescence, hormonal changes include the development of secondary sexual characteristics that influence body image. Among older adults, changes in mobility, thinning and graying of hair, and decreased visual and hearing acuity can affect body image. Stressors that affect body image include loss of body parts due to an amputation, mastectomy, or hysterectomy, loss of body function due to arthritis, spinal cord injury, or stroke, and an unattainable body ideal. External influences like media and other persons' perceptions and responses, cultural standards, and societal attitudes can affect body image. Clients who have a negative body image perception tend to be at risk for suicidal ideation. Identity is an inner sense of individuality that implies the person's uniqueness as compared with others. Achievement of identity is important for maintaining intimate relationships. Sexuality and sexual health are vital components of general health and a part of a nursing assessment. Sexuality is an integral part of identity. Its focus changes during various stages of the lifespan. Sexual health is a physical, mental, emotional, and social well-being regarding sexuality and sexual activity. Aspects of sexual health include knowledge of sexual behavior, understanding of expected growth and development, and access to appropriate healthcare resources for preventing and treating problems related to sexual health. Sexuality is affected by each developmental stage. For example, during adolescence, primary and secondary sex characteristics develop, menarche occurs, relationships involving sexual activity can develop, and masturbation is common. Sexual orientation can include a wide variety of attractions and can change over the lifespan. Sexuality is influenced by culture. Cultures can view premarital sex, homosexuality, and polygamy differently. Sexuality affects health status. Some conditions can alter sexual expression. For example, the presence of a sexually transmitted infection can cause fear of transmission to a partner, leading to a decrease in sexual desire. Some medications affect sexual functioning. Diuretics decrease vaginal lubrication, causes erectile dysfunction, and reduces sexual desire. Antidepressant medications can cause erectile dysfunction and reduce libido. Assessment or data collection for sexuality can include observing the following: posture, appearance, demeanor, eye contact, grooming, and unusual behavior. We also want to discuss the client's feelings about body image, self-concept, or sexuality. For example, a refusal to look at or care for incisions or ostomies after surgical alterations can indicate a body image disturbance. Nurses need to obtain a sexual history from clients who report sexual problems or are receiving care for relevant conditions like pregnancy, contraceptives, sexually transmitted diseases, and infertility, and for clients who might experience a change in sexual functioning due to a condition or treatment like diabetes, heart disease, cancer of the reproductive organs. Nurses need to ask about sexual orientation and preferred pronouns or terminology related to sexual self-concept or identity. We need to ask if the client is sexually active and whether there are any concerns about sexual function, discomfort, or pain during sexual activity. Other factors to include are cultural background, quality of relationships, coping mechanisms that have been helpful in the past, and evaluation of self-worth. There is an assessment tool used for sexuality, but I don't expect you to memorize it. Some things we need to do for patient-centered care and self-concept. We can encourage a healthy lifestyle like exercise, diet, stress management. Encourage the client to verbalize fears or anxieties. We can use therapeutic communication skills to assist them with self-awareness. We can encourage the use of affecting coping skills. We can reinforce successes and strengths. For body image, we can establish a therapeutic relationship with the client. A caring and non-judgmental manner puts the client at ease and fosters meaningful communication. We can ensure privacy and confidentiality, let the client know that sensitive issues are safe to discuss. We can identify individuals who can be at risk for body image disturbances. We can acknowledge anger, depression, and denial as feelings to be expected when adjusting to body changes. We can arrange for a visit from a volunteer who's experienced a similar body image change. And we can reinforce clients' strengths and help them find the assistance they need. To provide patient-centered care for sexuality, we can allow the client to discuss issues and concerns related to sexuality. We can be straightforward with questions in a relaxed manner. Are you or have you been concerned about sexual functioning since your surgery? We can ask the client to describe factors that influence sexual desire. We can educate clients about enhancing sexual health. And then we can determine the client's current understanding or knowledge base regarding sexuality and provide developmentally appropriate education like contraception or prevention of STDs or immunizations. We can teach ways to make sexual activity safer like barrier methods, including condoms or dental dams. We can incorporate knowledge from nursing and other disciplines in understanding sexuality. We can inform the client of available resources and support groups. We can never assume that sexual function is not a concern. And we can discuss alternative means of sexual expression like hugging or cuddling if the client experiences a change in body function or structure. We also need to be aware of situational role changes. A role is the function a person adopts within their life. Seldom is it limited to one role, but rather it is multidimensional and is often relative to the role of others. Some examples include grandparent, parent, dependent child, employee, employer, committee member, or community activist. Stress affects roles in many ways. Illnesses can cause role stress by creating a situation in which roles can change simply due to the effects and progression of the illness. When someone gets sick, their role usually changes to becoming dependent, which can be very, very hard. Nurses must be aware of a client's role in life as well as how the situation of illness might change these roles, either temporarily or permanently. A basic assumption is that a client can either advance or regress in the face of a situational role change, meaning they can do better or they can not do as well. There are different types of role problems. One is role conflict. This develops when a person must assume opposing roles with incompatible expectations. Role conflicts can be interpersonal, when parents expect adolescents to participate in sports and perform household tasks, or interrole, when a mother wants to stay home with her infant, but family finances require her to work. A sick role is when expectations of others in society regarding how one should behave when sick, so caring for self while sick and continuing to provide child care to grandchildren. Role ambiguity is uncertainty about what is expected when assuming a role. It can create lots of confusion. If suddenly the breadwinner has to take on the sick role, the stay-at-home parent may have some role ambiguity about what is required. There can be role strain, which is the frustration and anxiety that occurs when a person feels inadequate for assuming a role, like caring for a patient with dementia. Caregiver burden results from the ongoing stress associated with caring for someone else over time. Role overload is when there's more responsibility and roles than are manageable. It's very common, especially when you are a student, an employee, and a parent at the same time. Situational role changes can be caused by situations other than physical growth and development, like marriage, a job change, or divorce. Situational role changes can disrupt one or more of the client's roles in life with illness or hospitalization. Without resolution, situational role changes can contribute to healing in the physical, mental, and spiritual realms. In temporary role changes, the client will resume the role when the illness resolves. So if a wife is sick, the husband may have to take up many of the domestic duties that the wife may have performed, or may have to go back to work if the wife was the breadwinner. Permanent role changes happen when illness has altered the level of the client's health to a point that previous roles are no longer available. This would be something like a chronic condition or cancer where the patient cannot go back to their previous roles. Things that nurses can do when patients have role issue problems is to educate them on potential social isolation, physical demands, and other stressors, and also on the resources available in the community. Nurses can provide short-term care to provide relief for the family caregiver. So if someone has to take on the new role of family caregiver, a nurse can give them respite when we're taking care of their family member in the hospital or in long-term care. We can provide encouragement during times of stress. We can prepare the client for anticipated situational crises, so we can let them know that things that they might be responsible for now that their loved one is in the hospital or had a role change. We can anticipate role conflict or overload on the client's part. We can improve relationships by supplementing specific role behaviors. We can also explore which roles the client can relinquish. How bad is a dirty house when your spouse is suffering from something in the hospital? Not quite as bad as normal. We can help the client improve personal judgment of self-worth given the current situational role change. We can provide counseling about roles that are permanently altered. We can refer patients to community services for outpatient adaptation to lost or new roles. We can also make referrals to social services for assistance in some roles. We can also evaluate the client after acceptance of the role changes to assess adaptation. So we really are paying attention to what these role changes, how they affect our patients that we're caring for and the family members.